Did you know that sexually transmitted infection can destroy your brain and heart if ignored? One of them is syphilis. Syphilis is a sexually transmitted infection caused by a bacterium, Treponema pallidum. Syphilis is a chronic infection, meaning that it can stay in body for a long time. Syphilis develops slowly and it can also progress in stages if not treated. Even when symptoms disappear, the disease may still be active inside the body. Syphilis is caused by a bacterium, not a virus. The name of the organism is Treponema pallidum with spiral-shaped structure, that is the aspirochete. It is very thin and delicate and it cannot survive outside the human body. This bacterium can easily be killed by penicillin and it is very hard to grow in the lab. Because it's very hard to grow in the lab, syphilis diagnosis is carried out using blood tests and not cultures. Why syphilis is a serious disease? Syphilis is not just a small sexually transmitted infection. If untreated, it can damage the skin, the heart, the brain, the blood vessel, the ear, the eyes, and the bones. In severe cases, it can lead to blindness, mental illness, stroke, heart disease, and death. This is why syphilis is considered a systemic disease, not only genital infection. Syphilis is normally called the great imitator. Why syphilis is called the great imitator? Syphilis is also known as great imitator because its symptoms look like other diseases. It can be mistaken for skin allergy, fungal infection, typhoid fever, HIV related illness, and mental health conditions. As a result, many people are misdiagnosed, treatment is delayed, and complication and life-threatening conditions develop. Some people ask if syphilis is common. Is syphilis common? The answer is yes. Syphilis is one of the major global health problems. Millions of cases occur every year worldwide. It can affect both men and women, young and old, married and unmarried. Anyone who is sexually active can get syphilis. One unique thing about syphilis is that symptoms can appear and disappear without treatment. This does not mean that the person is cured. Instead, the infection enters the stage called silent stage or latent stage. Here, despite the absence of symptoms, the bacteria continue to damage the organ slowly and serious complications may occur years later. So, syphilis is curable, especially when detected early. It can be treated with antibiotic penicillin. Early treatment prevents complication and stop transmission. Late treatment may kill the bacteria but may not reverse organ damage. So, early diagnosis and early treatment is the key. Understanding syphilis is very important because many people don't know that they are infected. Early symptoms are painless and often ignored. Untreated syphilis can destroy the vital organs. It increases the risk of HIV infection and also it can be transmitted from mother to unborn child. Syphilis is a bacterial sexually transmitted infection and it can progress in stages. Symptoms may appear and disappear when the infection enters the latent stage or silent stage, but the disease still remains. It can also lead to long-term damage of organs and tissues. Despite all these things, early diagnosis and treatment saves life. So, syphilis is contracted through direct sexual contact with an infected person. It could be vaginal sex, that is from genital to genital, and oral sex, genital to mouth, or mouth to genital, and anal sex, genital to anus. So to ensure safety, condom is highly recommended. during sex to ensure protection, even though it doesn't guarantee 100% protection because it can burst during sexual intercourse, but still it is still recommended. Condom must be used from the beginning to the end to ensure protection. So that's the thing. And again, you should abstain from putting your mouth in woman's vagina. That thing is already. You should not put your mouth where doctors use gloves. This is because of throat or pharyngeal syphilis, which is very difficult to treat. And again, there is mother to child transmission or congenital syphilis. This occurs when the syphilis is passed from the mother to the baby. And to prevent this, antenatal screening is carried out during pregnancy. So that's the thing. Thank you for watching. If you find this video helpful and educative, share to other people so that they can learn. Subscribe to this channel, like and comment. See you next time. Thank you for listening once again.